Hi Jasmine, so we just wanted to ask you a couple of questions about teeth straightening, specifically aligners. So do you mind answering some?
Sure.
Okay, perfect. So Jasmine, the first question that we wanted to ask you is how exactly do aligners work to straighten your teeth?
Okay, so aligners are essentially clear plastic retainers. I can show you a little example of these. This is them here. They work by basically covering all your teeth and providing gentle movements on each tooth in order to push them into the desired position.
And how many hours each day must I wear the aligners for them to be effective if I was your patient?
So we recommend wearing them 22 hours a day. So it is the majority of the day. So you've roughly got about 2 hours for eating and drinking anything you like.
And are aligners noticeable, or will people know that I'm wearing them?
So they are one of the most discreet ways of straightening teeth. This is them on here, so I can show you an example. And this is what it looks like off. So you can barely tell. You would have little kind of bumps on the teeth, which we call attachments, and if someone came up really close, they would be visible, but they are blended to your tooth colour, so most people don't realise that you're wearing them.
And can I eat and drink normally while I'm in treatment? And what about brushing and flossing?
So yes, you can eat and drink what you like. That is one of the great benefits of clear aligners, because you do take them out for eating. So pretty much anything is fine. Obviously you have that limited time of the day, so it does stop you from snacking, which is quite good. And brushing and flossing as well. Your electric toothbrush, you don't have to worry about, wires breaking or food getting stuck in wires, things like that, because you can pass the floss in between all the teeth as normal.
And how often will I need to change aligner trays, and how many appointments are involved?
It does depend on each person in terms of number of days. You're roughly looking between 7 to 10 days per aligner. So once you have a treatment plan made up and you find out the number of aligners that you need, that kind of gives you a rough indication as to the timeline of treatment. So most of my patients change every 7 days.
And what about pain? Will the treatment be uncomfortable?
So it's normal to expect a little bit of discomfort when you first start wearing the aligners, but that soon disappears. It may be less. It's more the pressure and awareness that something is moving, essentially. You shouldn't need any painkillers or anything like that at all.
And how do I clean and care for my aligners to keep them hygienic and safe?
We actually provide a little Zimmer pod, so it's like an ultrasonic bath for your aligners. So that's what we recommend to clean them every day. Using that, you just pop them in and they're ready in a couple of minutes. You could also use the electric toothbrush to clean them, ideally every night before bed. That should be used, or you can get little retainer bright tablets that you dissolve in water, and again pop the aligners in just to soak off any bacteria.
And what happens after the aligner treatment? How long will I need to wear a retainer?
Yeah, so that's great. That brings me on to retainers, which is essentially for life. If you don't want teeth to move, the advice now is that you should be wearing retainers for life, and it's really, really important to commit to that before you start any kind of aligner treatment, because that is the biggest investment, to be able to continue wearing them and commit to wearing them for life after, just overnight though.